In clinical genetics, the first topic of discussion is the syndromes, and the first one is Down syndrome. Very high yield, very much interrelated. So, Down syndrome is actually the chromosomal defect at the chromosome 21 trisomy. So, at the age of 21, usually the new generation at the age of 21, they are going to experiment in their life and start drinking a little bit, like especially in the recreational activity. So we usually drink at the age of drink alcohol or non-alcohol things at the age of 21. So in first, it's a good mnemonic to learn how actually in which chromosome the defect is present. So it's actually Down syndrome at the trisomy at the chromosome number 21. So Down syndrome is the most common cause of genetically transmitted intellectual disability. So this genetic cause is very much important. Also, it's the first most common cause of viable chromosomal live birth. Monosomies, rest of the monosomies and trisomies are die by the age of 1. So Down syndrome is the most common viable chromosomal disorder in the live births. So how to diagnose, how to present the presentation of the Down syndrome is as in the Down syndrome we have the flat face, we have the prominent apicanthal folds, we have the 5 A's, and in the 5 A's we have the first one is atresia, duodenal atresia. We have the increased risk of leukemia, ALL and AML. We have atresia, AML, ALL, and also we have the advanced maternal age. It's the cause of Down syndrome, cause of genetic translocation. In the cardiac we have the atrioseptal cardiac defect 1, 2, 3, 4, and also there is a Alzheimer's, early onset Alzheimer's. So these are the 5 A's, very much important, and these are very much seen in the scenario. The less common symptoms are flat face, then we have the single palmar crease. In the iris we have the brush field spots. Also duodenal atresia, it can cause Hirschsprung disease. We can also see kidney disease like horseshoe kidney, and also we can see omphalo, Hirschsprung, and so these are the low yield point symptoms in the Down patient. The next thing is in the first trimester ultrasonography we can see increase nuchal translucency. Also we can see hypoplastic nasal bone development. Also we diagnose this by all the markers H and I, HCG, beta HCG, and inhibin is high, rest of the markers are low. And in the Down syndrome there is 95% of the chances of unbalanced Robertsonian translocation. And I will describe this Robertsonian translocation over here. Robertsonian translocation is actually whenever the two acrocentric chromosome came across, their short arm lost and their long arms get fused. So in this way the short arms of the two acrocentric chromosome is lost. So this is known as Robertsonian translocation. And in the Robertsonian translocation, physiologically there is a balanced translocation in which there is no gain and loss of chromosome. But if the translocation is unbalanced, then it can cause trisomies like genetic abnormality. So in the Down syndrome, the 4% chance of Robertsonian translocation, the 95% is actually the meiotic in the mitosis of the mom meiotic non-disjunction. 95% chances of meiotic non-disjunction, 4% chances of unbalanced Robertsonian translocation, and there is a 1% chance of the post-fertilization mitotic error. So these are the important high yield points which we have seen in the scenarios. So this is all about Down syndrome. And the Robertsonian translocation is also in the chromosome 2, 3, 4 and 5, 15, 14, 13, 22 and 21. So in Down syndrome we have the 14 and 21 Robertsonian translocation, unbalanced translocation. The next syndrome is Edward and Patau. So Edward, E for election. So usually the election age is 18, so it's a trisomy 18. So the Prince Edward, P for there is a prominent occiput, or for rocker bottom feet, which are more common in Robert than in Patau. There is intellectual disability, then there is a non-disjunction, especially the meiotic non-disjunction. C4 we have the clenched fist hypertonia with overlapping fingers, and E for ears, which are low set ears. The less common symptoms are there is micro jaw, there is a cardiac defects, there is also omphaloceal and meningocele. So these are the low yield points. High yields are these one, Prince. Okay, so the next is how to diagnose it. The diagnosis is pretty simple, that E for so decrease. In Edward syndrome, every marker is decrease in Edward. So no, not very much tested, but it came across in the MCQ option, in which there may be a distractive option in the boards. So Edward syndrome, it's also there is a, it's second most common live birth, but they die at the age of by the age of first year, before their first year birthday they die off. The next one is Patau syndrome. So in the Patau syndrome, so the puberty hit at the age of 13. So it's a trisomy 13, and in this we have a lot of P. We have the lip and palate. We have hollow prosencephaly. We have the polydactyly. We have the cutis aplasia. So why I write all the P's in the center? Because it's a midline defect. Also we have the polycystic kidney disorder. So all the P are in the center. So there is a precaudal mesoderm fusion defect in the precaudal mesoderm, which give rise to all the midline problem, like palate and lips are in the midline. Then we have micro head is in the midline. Then we have the micro eye, microphthalmia. We have the holoprosencephaly, brain is in the center, polydactyly, multiple fingers, and also we can see here rocker bottom feet, but they are pretty less common symptom. Then we have the aplasia, which aplasia? Cutis or head aplasia. Then we have the polycystic kidney disease. Also we have omphalocele GIT problem. We have the pump defect or heart defect, and also we can see here severe intellectual disability. So the P mnemonic are pretty much commonly appear in the symptoms. So they are appearing as a clue in the scenario. So the P's are important one. So this is the they also die at the age of by first birthday. So this is the three most high yield syndromes of the trisomies. The next one is we have the fragile X. Very much tested, very much correlated to fragile X syndrome. So fragile X syndrome is actually it's one of the Trinucleotide Repeat Expansion syndromes, and in the fragile X we have the X is very much fragile or delicate. So it's the most common cause of intellectual disability of inheritable type. Down syndrome is a genetic type, and this is inheritable type of intellectual disability, and it present during the oogenesis of the mom meiosis, in which there is a C and G and G. Why I wrote this in here? There is a chin problem, there is a giant gonads. So CGG repeat expansion or repeat hypermethylation or deactivation, which leads to decreased expression in the fragile FMR, fragile mental retardation 1 gene. And this can lead to the different dysmorphic faces. So symptoms are dysmorphic faces, in which face problem, in which we have the chin problem, like large mandible. Also we have the large ear. Then we have the macrogonads. Also we can see autism, attention deficit hyperactive disorder, important. Then we have the anxiety issues, so it's also important. The non-important or the less common symptoms are mitral valve prolapse, hypermobile joints. Sometimes the board gives us these two symptoms, mitral valve prolapse and hypermobility, in order to distract us from Fragile X to Ehlers-Danlos or Marfan syndrome. So these are the two tricky symptoms in the Fragile X1. So also we have the self-mutilation symptom. So these are the Fragile X. We have to see intellectual disability, inheritable type. We have to see the 3 nucleotide. We have to see the face. We have to see the gonad, and then autism, neuropsychiatric disorder. These 3 points highlight highlight that this is the Fragile X, not the Marfan or Ehlers-Danlos syndrome. So if the repeats are less than, these are the expansion greater than 200. So if it is less than 200, then it can cause ataxia, mild symptoms, ataxia, or there is a tremor. Also there is a primary ovarian insufficiency. So these are the mild symptoms. So in the trisomy trinucleotide expansion syndromes, we have other like myotonic dystrophy, Friedreich ataxia. Then we have the Fragile X syndrome and Huntington disease. And Huntington disease is related to CAGE, caudate, acetylcholine, GABA. Fragile X, we have the C, G, gonads, giant chin. Also Fragile X is X-linked disorder. Huntington disease is autosomal dominant. Friedreich ataxia is autosomal recessive. Myotonic disorder autosomal dominant. And in myotonic disorder we have C, T, and G. And Friedreich ataxia we have the G gate problem, or GAA. So these are in the trisomy, the last point is very high, that anticipation is very important. Anticipation in genetics is the early onset of the appearance of a disease and the increase in severity. Like if the father is suffering from Huntington disease or Friedreich ataxia at the age of 60, then if it is inherited into the son, then the son appear with a lot more severe expression of Huntington disease, and also at the early age of its life. So this is all about the anticipation. So anticipation work most typically in these 4 categories, which are trisomy, nucleotide expansion. And this is all about the clinical genetics of this topic. The last one is the Rett syndrome. The Rett is pretty much the return or the regression. Rett is sporadic, or it's also a return. What return? That there is a regression in the motor, in the verbal, in the cognitive function. Also there is ataxic gait, also seizures, and we have also there is a growth failure. So what's the regression? Like the infant first babble or speak a little bit words, but now he is verbally quiet, no verbal progress, the no motor progress. There is a stereotypic hand clapping or ringing. Also cognitive dysfunction. So this is most commonly at the age of 1 to 4 years, and specifically in the girls. So it's exclusively in girls because boys die at the age boys dies earlier, so not in boys, exclusively in girls. So it's a X-linked dominant cause of Rett syndrome, and it's a de novo mutation of the MECP2 gene, and in which there is not degeneration but there is arrested brain development. So this is the Rett syndrome, and two MCQs I have seen in the USMLE in the U world, that they are about the arrested brain growth and also the stereotypic hand clapping. So these are this is all about the clinical genetics of our genetics portion.